Stop for a second and really look at your nails. Not casually, not the way you glance at them while scrolling your phone. I want you to look very closely at the details, because what you're seeing right now might be the earliest warning sign your body has been trying to send you. Before pain, before diagnosis, before anything feels wrong, your nails may already know something is. And the most dangerous part? Most people ignore these signs until it's too late. We've been trained to think of nails as cosmetic, something to trim, polish, clean before going out. But what if I told you that those small, quiet surfaces at the tips of your fingers are actually one of the most powerful early warning systems in your body? And most people never learn how to read them. Serious conditions don't always start with pain. They start silently, slowly, subtly, and sometimes they show up first in places you would never expect, like your nails. Think about this for a moment. When was the last time you examined your nails with intention, not just noticed them, but actually checked them? Exactly. Over the years, doctors and clinicians have noticed something fascinating. Patients often come in with advanced symptoms, but when you look back, the signs were already there, visible, obvious, just misunderstood or ignored. There are cases where something as simple as a color change, a line, or a shape difference appeared weeks or even months before any serious symptoms developed. Your body doesn't stay silent, it whispers first. Your nails are one of those whispers. Let's understand why this happens. Your nails aren't just dead tissue sitting on your fingers. They're actively growing structures, formed deep under your skin. That growth area is extremely sensitive to changes happening inside your body. Blood flow, oxygen levels, nutrient availability, hormonal balance, inflammation. All of it affects how your nails grow. And because nails grow slowly, they don't just show what's happening now. They show a timeline, a history. What your body has been going through over the past several months. In other words, your nails are like a health record written in plain sight. The only question is, do you know how to read it? Imagine this. You're getting ready one morning, and you notice your nails don't look quite the same. Maybe slightly yellow, maybe pale, maybe even a faint bluish tint. You shrug it off. Lighting? Maybe. But here's the reality. Color changes in your nails are not random. They are signals. Yellow nails, for example, are often dismissed as harmless, but they can indicate fungal infections and sometimes deeper systemic issues. Pale nails? That could be your body struggling with low red blood cells, meaning less oxygen is being delivered throughout your body. And blue or gray tones? That's even more serious. It may mean your blood isn't carrying enough oxygen. Your body could literally be struggling to breathe properly at a cellular level, and your nails are showing it before you feel it. Be honest with yourself. Have you ever noticed a color change and ignored it? Strange lines that tell a story. Now look closely at your nails. Do you see any lines, vertical lines, horizontal grooves, or even a dark stripe running from top to bottom? Most people assume these are just signs of aging, and sometimes they are. But as we will see, this is not always the case. Horizontal lines, especially deep ones, often appear after your body goes through intense stress, illness, infection, surgery, even extreme emotional stress. Your body literally pauses nail growth to survive, and when it resumes, it leaves a mark, like a scar in time. Now here's where it gets more serious. A dark vertical line on a single nail, especially if it's growing, uneven, or spreading, can be a warning sign that needs immediate attention. This is not something to wait and see. Think about this. Your nails might be showing you a timeline of trauma your body experienced, events you may have already forgotten. 3. Shape changes that signal deeper problems. Take your hand, turn it sideways, and look at your nails from the profile. Do they curve normally, or do they look different? Some nails become spoon-shaped, dipping inward. Others become unusually rounded, almost bulging outward. These are not random changes. They're structural signals. A spoon-shaped nail can indicate your body is lacking essential nutrients, especially those needed for oxygen transport. Your body prioritizes survival, so when nutrients are low, peripheral areas like nails are the first to show damage. On the other hand, excessively curved nails can be linked to deeper issues involving the lungs or heart, meaning your body might be struggling internally, and your fingertips are reflecting it. It sounds unbelievable, but it's real. Look again at your nails. Are they telling you something? 4. Brittle, peeling, or breaking nails. Now let's talk about something very common. Weak nails, brittle, peeling, breaking easily. Most people blame external factors, weather, water, cleaning products. And yes, those play a role. But what if the real issue is internal? Your body relies on balance, hydration, hormones, nutrition. When something is off, your nails are often among the first to weaken. Think of your nails like dry soil. When everything is balanced, they're strong, smooth, resilient. But when something's missing, they crack, split, fall apart. And here's the important part. There are different types of damage, and each one can point to a different underlying issue. Brittle nails may suggest dehydration or hormonal imbalance. Peeling nails can indicate your body isn't absorbing nutrients properly. Crumbling nails? That could be something deeper affecting the structure itself. Ask yourself, how often do your nails break and you just ignore it? Most people focus only on the nail itself, but the surrounding skin, it's just as important. Frequent hangnails, redness, swelling, pain around the nail edges. These are not just minor annoyances. They can signal that your body is struggling to repair itself properly. And when healing is impaired, it often means something deeper is going on. Your immune system, your nutrient levels, your internal balance, all connected. Think about someone who constantly gets small cuts that don't heal quickly. That's not random. That's a message. Your body is saying, I need support. Are you listening? Here's something critical. Gradual changes can be normal, but sudden changes, those are the ones you should never ignore. If your nails looked one way for years, and then within weeks, something changed dramatically. That's your red flag. Sudden discoloration, sudden ridges, sudden weakness. Your body doesn't change like that without a reason, and that reason is worth investigating, not later, now. A man in his early 40s noticed a dark line forming on his thumbnail. He thought it was nothing, maybe a bruise. Weeks passed. The line didn't go away. It got slightly wider. Still, he ignored it. It wasn't painful. Months later, during a routine check, it was examined, and what started as nothing turned out to be something serious. The difference? Time. Early attention could have changed everything. A woman constantly struggled with weak, peeling nails. She tried everything. Supplements, creams, treatments. Nothing worked. Eventually, she looked deeper. It wasn't her nails. It was her body's ability to absorb nutrients. Once that was addressed, her nails improved naturally because the root cause was finally understood. An older gentleman noticed his nails becoming thicker and harder to trim. He thought it was just age. But over time, he also noticed discomfort in his legs. Turns out, his circulation wasn't functioning properly, and his nails were showing it long before the discomfort became noticeable. Listen to what your body is telling you. Common mistakes. Let's clear up some dangerous misconceptions. Mistake 1. It's just cosmetic. No, your nails are biological indicators. Mistake 2. If it doesn't hurt, it's not serious. Many serious conditions don't hurt at first. Mistake 3. It will go away on its own. Sometimes it does. Sometimes it doesn't. Waiting blindly is risky. Mistake 4. Everyone's nails look like this. Comparison can be misleading. Your baseline matters. Action plan. Starting tonight. Do this. Take 5 minutes. Sit under good lighting and check your nails properly. Look at color, shape, surface, strength, and surrounding skin. Compare both hands. Look for differences. If you notice something unusual, don't panic, but don't ignore it either. Take a photo, track changes. And if something persists or worsens, get it checked. Early awareness is power. Your body is not against you. It's constantly trying to protect you, communicate with you, warn you. The problem is, we've been taught to ignore the quiet signals, to wait for loud symptoms. But by then, the damage is already deeper. Your nails are not random. They are not meaningless. They are part of your body's language, and once you learn to read it, you take back control. Now, I want you to do something simple. Look at your nails again, right now. And tell me in the comments, did you notice anything different? If this video opened your eyes even a little, share it with someone you care about, because they might be ignoring a sign they don't understand. And subscribe, because the more you understand your body, the better you can protect it.